Hi guys, welcome to the tutorial for osteology of the thorax. Right. So right here that you see, that is an image that shows important bones that are involved in the thorax. So this is in the female and this is in the male. You can see that there is no difference. You have the same number of ribs in the female, same number of ribs in the male. Right. So right here, this is your sternum. Your sternum is divided into three. We have the manubrium, sternum, we have the body, we have the xiphoid process. And then we are going to have ribs. So a human being has 12 pairs of ribs. So how many ribs does a human being have? 22 ribs, right? But a human being has 12 pairs. You can see 1, 2, to here it is showing 1 to 10. Why? Because this is what we call a costal margin, and then you're going to have 11 and 12 ribs that will be embedded into your abdominal musculature, right? Posteriorly, you're going to find, so right, so this is your thoracic wall. This is your thoracic wall. As you can see, your thoracic wall is conical in shape. It is a small inlet and a large outlet. The inlet is called superior aperture or thoracic inlet. This outlet is also called inferior aperture. The superior inlet is bounded posteriorly by the T1 vertebrae, anteriorly by the upper border of the manubrium, then laterally by the medial border of the first rib. Then the inferior aperture, it is bounded. So you have to understand that the superior aperture it will be covered by what we call suprasternal fascia. And then here, the inferior aperture is going to be covered by the diaphragm, right? So, what are the boundaries of the inferior aperture? Anteriorly, you have the xiphoid process, mostly the xipisternal joint, and then posteriorly you have the 12 vertebrae, and then laterally you have the costal margin, right? That is made by rib 7 to rib 10, right? You can see this, right? Right. So this will be anterior, the most anterior feature, that is the sternum, and then we are going to have vertebra. So your vertebra, you have the 12 vertebrae, which are called thoracic vertebrae, right? That will form the posterior wall of your thoracic wall. If you are going to look at the cross section of the thoracic wall, you're going to see that it is heart-shaped, right? Because you have the body of the vertebrae sort of like protruding inside the thoracic wall. So you're going to have sort of like a heart-shaped, right? And the most anterior being your sternum, the most posterior being your vertebrae, and laterally you're going to have your ribs. So let us start with the sternum. Right. So right here, this is your sternum. Your sternum is divided into three. Your sternum is divided into three. The most upper part of the sternum is called the manubrium, and then you have your body, you have your xiphoid process. The manubrium, it has articulating site with the following. It has three articulating let me say, four articulating sites. It is going to have an articulating site that it articulates with the clavicle, an articulating site which it articulates with the first rib, and then articulating site which it will articulate with the demifacet of the second rib, right? And then there is a joint that is between the manubrium and the board of the sternum that is called your manubrosternal joint. So this manubrosternal joint, it forms an angle that is called a sternal angle that that in surface anatomy it will have a ridge. It will have a ridge. So it forms a ridge, and that ridge is very important in surface anatomy because it marks the the position where you start to read your ribs. So when you are reading your ribs in surface anatomy, you cannot start with rib number one because the rib number one, the first rib, it will be inferior to the clavicle, sort of like it will be covered by the clavicle. So thereby you take note of the sternal ankle, and then you start to read from rib number two. And then in people that are thin, you can start to read from rib number 12, and then you'll be going upward. Right. So it articulates with the clavicle at this articular site, the first rib, it fully articulates with the first rib, and then it articulates with the demifacet of the second rib. So the sternal ankle it's a very important ankle because it forms a plane, right? So you have to take note of this. The suprasternal notch, which is this upper impression, the depression of the manubrium, it forms, that's the most superior border of the manubrium, and then it will be if we are going to draw a line, if you are going to draw a plane from this to this, you're going to identify that this position of the suprasternal or the jugular notch, it will be anterior to the second intervertebral disc, right? And then the sternal ankle, if we draw a plane, right, it is going to be between the vertebra of T4 and T5, or it will be aligned with the intervertebral disc of the fourth intervertebral disc, right? So the vertebra that is posterior to the manubrium, you have T3 and T4, right? That's your manubrium. The manubrosternal joint is a secondary cartilaginous joint. Most specifically, it is a syphysis joint, which means it also allows free movement, like minor movement. And then you get to your body, the body of the sternum. So the body of the sternum, embryologically, it was formed by four vertebrae that fused, and they fuse around puberty. They fuse around puberty. And these vertebrae, as they fuse, they form this body of the sternum. The body of the sternum superiorly it articulates with the manubrium by the manubrosternal joint, and then inferiorly to articulate with the xiphoid process, right? And then this body of the sternum, you're going to have to understand that it is going to laterally at its edge, it's going to receive costal cartilage of rib number 2 to rib number 7. You can see. So rib number 2 to rib number 7, they directly attach to the body of the sternum, right? So it will be the lower demifacet of rib number, all right, the costal cartilage of rib number 2 to rib number 7, right? So it's very important to take note of that. The sternal body, it will be anterior to the following thoracic vertebrae. So it will be anterior to the thoracic vertebrae T5 to T9. T5 to T9, right? That's all about the sternal body, the body of the sternum. So I said that inferiorly we have the xiphoid process. The xiphoid process is triangular and before 40 years, it will be a cartilage, and then it will ossify to become a bone at 40 years. And this is if for the process. It's going to communicate with the body of the sternum via what you call the zipsternal joint. And you have to take note of this, that the zipsternal joint is a joint that will be a secondary cartilaginous joint, but it's a synchrontosis joint, meaning to say that it's a secondary cartilaginous joint that does not move. So this one does not move. This one is a symphysis. It moves, right? So the zipsternal joint, it is important because the tip of the zipsternal joint, it will continue as the linear alba of the abdomen. We're going to talk about it in the abdomen. And then it is posterior to the zipsternal joint. You're going to have the zipsternal part of the diaphragm. And then anterior, you're going to have the rectus abdominis muscle attaching to the anterior portion of it. And you also have to take note of this, that the zipsternal joint, it will be aligned with the ninth thoracic vertebra, T9. So just a summary, this will be lower border of T2, between between T4 and T5, and then T9, right? So that's your thoracic, your anterior thoracic wall. Now let us go to the ribs, right? So as you see, this is your thoracic wall, and we say that a human being has 12 ribs, 12 pairs of ribs. So you have a rib number 1 to rib number 12. So ribs, they are classified. Firstly, they are going to be classified by the way they attach to the sternum. So you're going to have ribs that are called true ribs. True ribs are ribs that directly attach to the lateral end of the sternum. And these are rib number 1 to rib number 7. So rib number 1 to rib number 7, they will directly attach to the sternum. So these are called true ribs. And then you're going to have false ribs. So false ribs, this will be rib number 8 to rib number 10. Rib number 8 to rib number 10, these are going to be false ribs. Their costal cartilages, they are going to join the 7th costal cartilage and then attach to the sternum. So they indirectly attach to the sternum via the 7th costal cartilage. So what is important about the false ribs is that they will form the costal margin. And the most inferior portion of the costal margin is formed by rib number 10. So you can see rib number 10 here. So rib number 10, it will form what's called a subcostal plane, right? That will be anteriorly, that will be the most inferior part of the thoracic wall. So if we draw a line here, that will be a costal plane. So here, if I draw a line here, that will be it's going to be called a subcostal plane. The subcostal plane would be below rib number 10, and then it will be anterior to lumbar number 3. Lumbar 3, right? That's called the subcostal plane, right? So the ribs, right, they can be further classified according to their features. So first of all, you have to understand that the ribs, okay, before I go there, I said we have a true ribs, false ribs, and then we are going to have floating ribs. So rib number 11 to rib number 12, these are floating ribs. They also have a costal cartilage, but their costal cartilage does not attach to the sternum, but rather they are suspended in the musculature of the abdomen, right? So you have 12 ribs, rib number 1 to rib number 7 being your true ribs, rib number 8 to rib number 10, those will become your false ribs, and rib number 11 to rib number 12, these will become your floating ribs because they do not attach the sternum, right? Ribs can further be classified according to their features. So according to features, they are classified into 2. We have what called typical ribs and atypical ribs, right? So typical ribs, these are ribs that you have. All right, so let's view a typical rib, and then we are gonna view a non-typical rib. But for their uh, their classification, you have to understand that the typical ribs, we have a rib number 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 two, right? Rib number two is a bit controversial. There are a lot of stories about rib number two, either it is typical or atypical. But we, for the purpose of this video, may say it is typical, right? So we have rib number two to rib number nine. These are your typical ribs. So whatever that we are going to talk about the typical ribs, these are the ribs that are going to have those features: rib number one, rib number two, rib number nine. Then at non-typical or atypical ribs, you have rib number one, rib number 10, rib number 11, and rib number 12. Those are your atypical ribs, right? So let's look at the one typical rib, because a typical rib, it will have the same features with all the typical rib. So let's say if I'm going to look at rib number 5, it's going to have similar features with all the ribs that are between, that are rib number 2 to rib number 9. But we're going to look at each atypical rib: rib number 1, rib number 10, rib number 11, rib number 12. Right. Right. So this is your typical rib. This is rib number 5. So rib number 5 is a typical rib. So what makes a typical? What makes it a typical rib? First of all, you have to understand that a rib is an anterior end and a posterior end. An anterior end that is going to be attached to the costal cartilage, then a posterior end that is going to be attached to the vertebrae. So here, this will be your posterior end, this will be your anterior end. This will be your posterior end, this will be your anterior end. So your anterior end will attach to the costal cartilage, forming a costochondral junction. So this is what we call costochondral junction. It also can be referred to as a costochondral joint. So this is a secondary cartilaginous joint as well, and this one is similar with that of the xiphoid process because it is a secondary cartilaginous joint which is a synchrontosis, does not move. Right. So your rib is going to have these ends, and then it can be further, a typical rib can be further classified into 3 parts. You have a head, right? You have a neck, and then you have a shaft. You have a shaft, right? So this will be your shaft, and your shaft will be divided by it will bend anteriorly. It will form sort of like, it will arc anteriorly, and where it arcs or start to bend is going to be called an ankle. And an ankle of a rib is the weakest part of the rib. So if you are going to get into a car accident and there has been an anterior force on the thoracic wall, it's more likely to break the ankle because it's the weakest part of your rib. So your rib is going to have 2 borders: a superior border or upper border and an inferior border. So a superior border is smooth and rounded, but inferior border is sharp. And the inferior border is going to form medially what you call a costal groove. And the costal groove, it will ledge or it will accommodate what we call intercostal vein, intercostal artery, and intercostal nerve. So the famous mnemonic is VAN, right? VAN, moving from superior to inferior. So you're going to have your vein, intercostal artery, intercostal nerve, right? So let's take a look here. We're talking about a typical rib. So a typical rib is going to have 2 demifacets or articular facets that will articulate with vertebrae. So a superior and inferior. The inferior, it is going to articulate with the corresponding vertebrae. and then a superior is going to articulate with vertebrae above. And then what divides these facets is what you call a crest. And a crest is going to articulate with the intervertebral disc. From the head, you're going to have this constriction that is your neck, right? And then you're going to have a tubercle. You're going to have a non-articular, so you're going to have a tubercle, right? And on this tubercle, you're going to have an articular facet, right? That will articulate with the transverse process of the vertebrae. So if you're we will summarize this once we are done with the vertebrae, right? So this will be a typical rib. So take note of this. A typical rib is going to articulate with the vertebrae at the 3 sides. 1, 2, 3. 1, 2, 3. Then in atypical, it is either going to articulate with the 2 or even articulate with 1. So rib number 1, rib number 10, 11, and 12. They don't articulate using 3 sides with the vertebrae. So let's take a look at rib number 1. So this is rib number 1. Your rib number 1 is very short and it is broad. Its superior surface is rough. Its inferior surface is smooth, as you can see here, right? It is not, what makes it an atypical rib is because it's going to articulate with, it only have one articulating facet on its head. So it have one articulating facet, right? And then, yes, it's going to have an articular facet, the transverse process via the tubercle, yes. But what makes it atypical is that it only have one articular surface with the body of the vertebrae. At the superior border, it is very important to take note of it because it has impressions, it has depressions or grooves. So you're going to have what you call a scalene tubercle. So your scalene tubercle, it will start from the medial border of your first rib and then it goes to the superior border but does not reach the outer border or the lateral border. So this will be the attachment of your scalene anterior muscle. So your scalene anterior muscle is very important because it's going to divide the grooves. So anteriorly, you're going to have the groove for the subclavian vein. Posteriorly, you're going to have the groove of the subclavian artery. Take note of this. The veins are anterior. The artery is posterior. So this will make sense more when we have done what we call the superior mediastinum. Because you're going to understand that these veins that are anterior here, they will also be anterior in the superior mediastinum to the what? To the arteries. So this will be your subclavian vein. So anterior we have the subclavian vein, it will be here. And then posteriorly, you're going to have this groove that is for the subclavian artery. And take note of this. The subclavian artery will be also with the lower border, the lower trunk of the brachial plexus. So you have the brachial plexus, remember, and the lower trunk, it will be here. So clinically, you are going to discover that there can be variations in individuals. Some of the individuals, they are going to have what we call a cervical rib. A cervical rib. So a cervical rib, it can be found from, it starts from C12, it starts from C7, there's no C12. It starts from C7 and then it will extend on the superior border of your first rib. So it's sort of like an accessory rib, right? Exactly. So what is important clinically is that this cervical rib, since it will be at the superior border of the first rib, and then we know that there are structures that we find on the superior border of the first rib. Anteriorly, your subclavian vein, posterior to the scalenus tubercle, your subclavian artery, and the lower trunk of your brachial plexus. So the the patient with a cervical rib can have a compression of the lower trunk of the brachial plexus and the lower trunk and the subclavian artery. So this will cause what you call the superior aperture syndrome. So the superior aperture syndrome. So what happens when you compress the lower border, the lower trunk of your brachial plexus? You're going to have from upper limb, you're going to have pain that will be radiating from at your medial border of your upper limb, right? Medial border of your upper limb. So that is clinically important, right? So here's your second rib. So your second rib, some texts they refer to it as atypical because of its shaft. That the shaft of the second rib is not similar with the shaft of the what? Of the typical ribs. But rather me, I can say that this second rib is part of typical, because what classify a rib to be typical, it's its articulating facets. So the second rib, it will articulate, it has three articulating sides. It articulates with the transverse process, it articulates with the superior and inferior costal facets of the vertebral body, right? And now let's go to, so you can see this is your fifth rib, right? Your fifth rib right here. Anteriorly, your anterior end is continuous with the costal cartilage attaching to the sternum. The posterior end, it will have three articulating side faces. It's going to articulate the transverse process of the corresponding vertebrae, and then it's going to have two articulating facets, superior and inferior. Then the inferior is going to articulate with the corresponding vertebrae. So how does the vertebrae articulate with the rib? So if it is a typical rib, you have to take note of this. A typical rib, it will articulate with two vertebrae, a corresponding vertebrae and a vertebrae above. So if this is a rib number 5, which means this one is going to be vertebrae T5, and then it's also going to articulate with T4, that's the rib above. So that's why you have two articulating facets. The inferior one articulated the corresponding vertebrae, and then the upper one will articulate with the vertebrae above. And take note, the crest of the vertebrae will also articulate with the intervertebral disc. Intervertebral disc between this one and this one. Is it? Right. So that's your typical vertebrae. Let me see if I can find, okay. So let me just talk about the 10th, 11th, and 12th rib. The reason why they are typical is the same. The 10th rib to articulate, it is one articulating, it is a single articulating facet with the vertebrae, and it may or may not have an articulating side to the transverse process. And then the 11th and the 12th, we already have to know that the 11th and the 12th, they are similar. And the 11th and the 12th, they both have no neck, no tubercle, right? No ankle. They don't have all of those. And they only have one articulating side with corresponding vertebrae. Very important. Right. So let us talk about the vertebra now. So we said posteriorly, we are going to have the thoracic vertebrae. So the thoracic vertebrae, we have it called T1 to T12. And this one can also be further classified into two. You can have atypical and typical thoracic vertebrae. So atypical thoracic vertebrae, we have, let me start with typical. Typical thoracic vertebrae, we have vertebra number 3. You have vertebra number 2 to vertebra number 8, right? So vertebra number 2 to vertebra number 8, these are typical. And then atypical, you have vertebra number 1, vertebra number 9, vertebra number 10, vertebra number 11, and 12. These are atypical. Let's look at an atypical vertebra. So a vertebra, it has two parts. Do I have a cross section? Right, good. So this is your vertebra. It has two parts. It's going to have a body, what you call a vertebral body, and then it's going to have a vertebral arc. This will be a vertebral arc. The vertebral body is ventral, or let's say anterior. The vertebral arc is posterior. The vertebral body in the thorax is going to be heart-shaped. What do we find in the thorax? We have the heart, right? So in the thorax is going to be heart-shaped. Then the vertebral column of the lumbar vertebra is going to be kidney-shaped, and so forth, right? So this vertebrae, this is your vertebral body. And then you're going to have posteriorly, you're going to have extension from your vertebral body directly. That will be your pedicles. So this is a pedicle, right? And then from your pedicle, this pedicle, they are going to be anterior to your lamina. And the pedicle do not join, right? And then you're going to have this pedicle, they are going to extend as the lamina. So this will be your lamina. Your lamina is going to join. So you're going to have you're going to have the transverse, the vertebral body, a pedicle, and a lamina forming this circular narrow, narrow space, right? So what is important to take note of this? To take note is this: between the pedicle and the lamina, you have the transverse process. So the transverse process that we said is going to articulate with your rib. So this will be a transverse process right here, right? You can see. So you can see this is your transverse process right here. So this is will be your pedicle, and then you're going to have your lamina, and then the lamina is going to continue as the spine of this of the what? The spine, or what called the spinous process, right? Right. So what you need to take note of is that the spine of your thoracic vertebrae, they are long and uh, they are long and slender, right? Projecting downward and backward, and then as you descend from T1 to T12, they move from being oblique to horizontal. So if you look at the transverse process of T12, T11, the spinous process is a bit horizontal than the spinal process of T3, right? And these spinous process, they are going to be attached by ligaments, which are called interspinous ligaments, right? Yes, that is important. So we go to your transverse processes. So the transverse processes that we said they are between the lamina and the pedicle. When you are moving from T1 to T12, they decrease in size. Thereby, T12 and T11, they will no longer have an articulating site on their transverse process because they will be very short. You can see. So that's why we said the T11 and T12 ribs, they are atypical. Why? Because they don't even articulate with the transverse process. Right? No articulation with the transverse process. Right. So you have to take note. You also have to take note. So we said this is your this is your, let me look. So this will be your lamina. This will be your lamina. This will be your pedicle. So what joins two laminae or adjacent lamina is what you call ligamentum flava. So ligamentum flava is going to join this lamina and the lamina above. It's very important for you to take note of. This lamina and the lamina above, right? So these are the spinous process. I spoke of it, right? So this is your vertebrae. These are your vertebrae. So let's now classify typical and atypical vertebrae. So typical and atypical vertebrae, you're going to have vertebra number 1 being atypical, vertebra number 9 is atypical, but rib number 9 is typical. Why? Because rib number 10 is only one articular facet. So thereby vertebra number 1, it only number 9, it is only going to have one articular facet for the corresponding rib number 9, but not for the 10th, right? And then the 10th and the 11th and the 12th, these are all atypical, right? So we have managed to summarize the osteology of the thorax. We spoke of the sternum, right? We spoke of the ribs, right? We spoke of the vertebrae, right? So you have 12 ribs, and then you're going to have 11 intercostal space between these ribs. The sternum divided by into 3, mandibular, the body and the xiphoid process, and then your thoracic vertebrae. You're going to have 12 T1 to T12. So that's everything that I have for you today. Thank you so much, guys, and take care.